Howdy folks, I'm Dr. Will Wong. You know, when I had my first herniated disc, I discovered that all the folks who had developed rehab programs and stretching programs for low back pain didn't know a hank about what they were talking about because they'd never had a lower back pain. They had never had the disc pain, they had never had the sciatic pain, they had never experienced what I was going through. So the rehab programs that they developed actually hurt. Lower back rehab is really simple. Now I'm going to preface this by telling you, I have probably more spinal injuries than any 9 of you combined. I have 5 cervical fractures, cervical, neck. I have 1 unhealed fracture, a compression fracture at T10. I have 3 lumbar herniated discs. I have 2 lumbar compressed discs. I have spina bifida occulta, and a few other things I probably can't remember. All that tallied up from work injuries, from skydiving, from years of sports, from motor vehicle accidents. All that together means that I'm one heck of a mess in my back. Yet, I haven't had to have surgery. My first herniated disc was when I was 32. I'm now going on 65, and I've been fully mobile, been fully exercising. At my peak before I stopped doing really heavy work, when I was about 55, 57, I was squatting still in the high 400s. I was deadlifting in the high 300s. So, stretching the low back, stretching out the sciatic pain, stretching out the lumbar disc pain, and treating it is actually very simple. There are 4 most grossly affected muscles in any kind of lower back injury, in any kind of lower back pain. The first is the quadratus laborum. The second is the Iliopsoas group, which is actually made up of 2 muscles, the iliacus and the psoas major. The third is the iliotibial band going down from the hip, down the side of the thigh. And the fourth is the piriformis. Now, between the piriformis and the iliotibial band, we have both kinds of sciatic pain. The sciatic pain that goes to the side of the thigh, the collateral branch of the sciatic nerve, ends up in the iliotibial band. The direct pain down the back of the thigh from sciatica, the one that goes down into your ankle, is down the piriformis branch. The piriformis is a little muscle that runs from the outer lip of the sacrum across to the hip. And in most folks, it scissors. It's got 2 separate bands, and the sciatic nerve goes through the middle of the band. So when the muscle spasms, it scissors the nerve and creates that hell of a terrible pain going down your leg. So, how do we stretch them out? Here's the program that I developed for all my herniated discs. Now I have to tell you, my first herniated disc, when I was just feeling around how to get over it, how to get around it, took me 8 months to get over. The second and third ones took me just about a month. The third one took me 3 weeks total. I went from walking with a cane to deadlifting 375 in 3 weeks. And I'll tell you how we did that. First stretch is the seated toe reach. So, find a chair, a bed, a sofa, stout coffee table, anything that will hold you flat. Sit up, put your legs out in front of you, walk your fingers down your legs as far as you can go, grab onto the furthest point, let your head hang down, let your shoulders round off, and count to 20. Once you reach 20, let your fingers roll up, rest for 10 seconds, and do it again. Do this stretch 3 times, 20 seconds apiece. That will get the hamstrings, the glutes, and the erector muscles. Now, the next stretch is the most important one. I have been seen hanging off of tailgates on interstates doing this stretch because in the middle of a long drive, the sciatic pain just kicks in and you just have to relieve it. This is the way to relieve sciatic pain. You get on your bed, get on the edge of your bed or your sofa. You lie back. You keep your shoulders and your chest, your upper back flat on the deck. You take your hip on the side that's open, let's say this is the open side of the sofa, and you take the leg from the opposite side and you bring it over. You see how I'm rotating my hips as opposed to my shoulders. I'm not bringing my shoulders up, I'm just rotating the hips. Now, somewhere between 90 and 45 degrees of hip flexion, you will find the most painful spot. When you found that spot, drop your ankle down, put your hand right here, kind of force your ankle down, and hold that for 20, 30 solid seconds. Then let up, roll back, rest for 10 seconds, and do it all over again. Do each side 3 times. So when you're done with this side, sit up, flip over, put your head on the opposite side, bring the other hip over. You get the idea. The last stretch is for the iliopsoas. Now the iliopsoas is the muscle that comes up from the hip and attaches onto the front of your lumbar spine, and it causes an awful lot of pain and keeps you from being able to fully stand up when you're in back pain. You come to the edge of your bed or the edge of a table. You lie back. You bring a knee up. Bring the knee as far back as you can, and you let the other hip dangle. It's important. The bottom leg is the most important leg in this stretch because the bottom leg is the one that's actually stretching the iliopsoas. So you pull up, and you know if you've got a tight iliopsoas because when you pull up, your opposite knee will come up, like that. That's how we test for a tight iliopsoas. So you pull up, you let the other leg dangle, down to 20, when you get to 20, switch sides. You get to 20, switch sides again. Do each side 3 times, and you're done. Do the stretch every morning before you get up out of bed, every night before you go to sleep, and any time in the middle of the day you feel your lower back pain closing in on you. The more you do it, the less you'll have to do it. The more your muscles will loosen up. The less pressure you'll have on your nerves. Now, on top of that, you need to supplement because in the case of an actual herniated disc, you've got the nucleus pulposa. Imagine a disc is a jelly donut. You've squished the disc so that the jelly pops out the side of the donut, and that jelly is pushing on your nerves, and the direct pressure of the jelly on your nerves is what's causing that awful, terrible pain. So, you take 3 zymescents 3 times a day. That's a very, very, very high dose. 3 zymescents capsules 3 times a day for 3 to 4 weeks. What the enzymes will do is they will act like the old chymopapane injections. Back 30, 40 years ago, herniated discs were very well and easily treated by injecting the nucleus pulposa with chymotrypsin and papain. That would eat away at the nucleus and relieve the pressure. But that was too cheap a fix. It was costing orthopedic surgeons a bundle because they weren't doing as many surgeries anymore. So they phased the chymopapane injections out for the reason that it was costing the orthopedist money, not because it wasn't any good, not because it wasn't doing great things for the patient. It was costing the medical system money, because not only did the orthopedists not make money, the nurses didn't make money, the hospitals didn't make money by renting out the operating theaters, etc., etc., etc. We can get all around that. Take 3 zymescents 3 times a day for 3 to 4 weeks. At the 3 or 4 week mark, bring it down to 2 zymescents 3 times a day and stay there. Along with that, take 1 mag scorbate, very absorbable magnesium ascorbate capsule, 1 mag scorbate twice a day, because magnesium helps to release the muscle spasms that you'll have. Between the 2 of those, you will begin to eat away at the nucleus pulposa. You will relieve the muscle spasm, you'll relax the muscles, you'll reduce the inflammation, because that's what systemic enzymes do, is they lyse away at the pro-inflammatory cytokines that cause inflammation. They eat them. then the enzymes will prevent scar tissue from building up in the lower back, because one of the things that always happens with a lower back injury is the beginning of spinal stenosis. If you can keep that stenosis at bay for longer, you'll be functional for longer. So, the stretching, the enzymes, the magnesium, you'll see miraculous things happen to your lower back pain in very short order. In the next video, we will show you how to do the beginning of strengthening exercises for the lower back and the midsection that will carry you through the next phase of lower back and sciatic rehab. I'm Dr. Will Wong.